voice technology goes well beyond delivering general health information to consumers. The pandemic has accelerated the adoption of voice. To discover voice technology and its impact in the healthcare sector in India and globally, we have our next panel discussion on voice technology in healthcare. This session is brought to you by our gold partner, iMerit. It will be moderated by Dr. Haleema Yezdani, Ambassador, Global Telehealth Exchange. The panelists for this session will be Dr. Saurab Lall, General Manager, Hospital Operations at Max Healthcare, Mr. Abdullah Saleem, Group Chief Information Officer at Omni Hospitals, Ms. Archna Gupta, Group Head Patient Experience at CK Birla Hospitals, Dr. Jaideep Jesson Rayapudi, Senior Subject Matter Expert, Healthcare AI at iMerit. Dr. Haleema, the stage is all yours. Panelists, I please call you upon the stage and enlighten us with your great insights. Thank you. A very trending topic, voice technology in healthcare. I really want to know what our panelists have in store for us. In this pandemic situation, everyone's going berserk. So, Dr. Haleema, this is all on you.
Hello everyone, welcome to the Voice Tech Summit, and thank you Voice Tech Summit for this opportunity to talk about AI in healthcare. Well, before I begin with introductions, myself and the panelists, I would like to quote a small incident which happened. When I put up the flyer in my status and in social media, the first question I received is, "This is a tech summit?" I said, "Yes." "You're a doctor?" I said, "Yes." So this connection is what makes the AI up, AI in healthcare. So basically, not many people are still accepting it. There are some hiccups to get in the industry, get in the healthcare industry as such. But yes, we are working on it. And at this note, ladies and gentlemen, I'm Dr. Haleema Yezdani. I'm a general physician and diabetologist with around 20 years of experience. And 9 years of experience has been in telemedicine only. I'm the Global Telemedicine Ambassador in Global Telehealth Exchange and one of the Future 50 clinical leaders in telehealth recognized by the HIMSS. I have received around 13 awards for the same for telemedicine and my role in telemedicine and during the pandemic. The last one being the Karnataka Mahila Ratna Award. So, well, let us first know that actually sums up my, a bit of my introduction. Let us talk about the subject, just a small gist before I go ahead with the panelists. AI in healthcare, it is a vast session altogether. It's a big discussion in itself. So we are here to talk more about the voice AI in healthcare, about how it will assist the, managing the patients and how it will assist us in our long run in chronic patients and acute management during the pandemic, before the pandemic, and after the pandemic. If anything good happened during the pandemic, it is only that the AI or telemedicine received a huge jump. People started accepting it much more than before, and the hiccup or the hitch that people had about the role of telemedicine, in fact, died down. People accepted it more. We had consultations, and I myself have seen 7,000 patients through AI. So I guess humanly it would not have been possible to do such a huge number or to help the people out there at the hospitals to triage the patients. So AI had made all it possible during the pandemic. So let us move on. Let us start with the introduction of the panelists over here. Let us start with Dr. Saurab Lall. Sir, moving on to you. Could you please introduce yourself?
Thank you. Thank you so much. My name is Dr. Saurab Lall. I head up operations at a corporate network of hospitals, and we run about 15 hospitals across the country, majorly in North India and Maharashtra. It's called Max Healthcare. So most of our hospitals are, tertiary care, quaternary care hospitals, and we usually have a great belief in investing and adopting a lot of technology in terms of AI and IT customization and personalization to healthcare. As head of operations, I have the liberty to go ahead and create those platforms where we are able to marry technology with hospital operations, and I think that is the trickiest part when it comes to healthcare. So I think that's where we are. We I consider our hospitals fairly ahead of the curve as part of technology, and we'll have some discussions through the session. Thank you,
Sure.
Doc.
Thank you, Dr. Saurab Lall, for the wonderful introduction. And can I pass it on to Ms. Archna Gupta?
Hi, thank you, Dr. Haleema. My name is Archna Gupta. I work with, I am heading patient experience at CK Birla Hospitals. Big chunk of my work experience has been with hospitality, with Tata's and Taj Group of Hotels. Moved on to healthcare some 8 years back, have the opportunity of working with Manipal Hospitals, Fortis Hospitals, and now CK Birla Hospitals. Been stationed in Bangalore for a chunk of time, of almost 8 years now. So had the opportunity of working with a lot of tech startups and various fields, voice technology too. We'll talk about it when when the time comes to discuss.
Thank you.
Thanks.
Thank you so much. Pass it on to Mr. Abdullah Saleem.
Thanks, ma'am. Quickly, I look after the core group. In core group has got multiple business unit, including your hospitality, hospital, fintech, and and I look after the entire digitization for this group. And Omni Hospital comes under the one of the BU, and there are 7 hospitals, and it is covering Telangana and Andhra Pradesh, and very soon we are going to have in Bangalore and Chennai. Thanks.
Dr. Jaideep, please.
Thank you, Dr. Haleema. I'm Dr. Jaideep Rayapudi, and I'm representing iMerit Technologies. We are an end-to-end data solutions company for all things AI. And I had the healthcare division here in India. And I come from long experience with healthcare, academics, education, and technology. And looking forward to a great future using voice as a coming up technology.
Thank you, Dr. Jaideep. I would request you to hold on. So we'll start with the first question to you. So considering chronic ailments like diabetes, we have Alzheimer's, we have many more ailments which require constant monitoring, or I would say remote monitoring to be more precise in the world of AI. So my question to you, Dr. Jaideep, what is the use of voice AI in remote health monitoring, especially in conditions like diabetes and Alzheimer's? Over to you, sir.
Right. Excellent question, Dr. Haleema. And I think in the coming days, I hate to say it, but one of the good which has come out of the pandemic is the empowerment of the patient. And this is a movement which is global in nature, and the owner of healthcare has gone out from the hospital or a typical doctor to a patient. Now the patient decides what happens to their health. And here technology plays a major role, and artificial intelligence, and especially the user interface of using the voice technology, that is going to be a game changer in terms of use. Yes, we have been using our phones, we have been texting, we have been using chat bots. We call it chat, though we use fingers. Voice bots now. So when it comes to chronic diseases, and especially during the past 2 years when patients could simply not go to a hospital, even for a simple disease like diabetes or hypertension, the first, or I call it a lower level of artificial intelligence, would be to manage or maintain the health status of chronic patients with chronic disease. So simple things like, hey, you need to take your medicines now, it's time to take your medicines. Did you eat your food? Or isn't it time for your insulin shots? And simple technologies, these are all in development stage. Some apps have come out in the Indian market, in the Western market, little more advanced products are available for patients, and but at the same time there are automatic scales, weighing machines which will tell your weight, check for your diabetic ulcers for diabetics patients at one level, and the other level is of maintaining the health is for patients who are really not able to go out for help. So you think about the elderly, think about the people who just cannot, manage on their own. And for them, voice-based technologies have brought in something very unique to humans, which we from the medical community have always felt that only I can give this. That is empathy. So we are actually having voice-based technologies. It's an absolute robot. We know that. I mean, those who work with the backend know that it's a robot. But the client, the patient gets the feeling that they're talking to a real person. Empathy is something which can change the health. Of course, ultimately it will change healthcare. And that is at one level. I still call it the lower level. And same goes for a lot of neurological diseases, which I would put that in another category of AI at a higher level in terms of actual diagnosis. So the human voice, just to produce this voice of mine, the amount of brain power, the amount of the neurological activity which takes place just to produce my voice, the number of muscles which are moving to produce that. Now, like our previous speaker was saying, a voice does not change. But imagine if we are able to capture this voice on a regular basis, and the whole day we are talking on phones, we are on Zoom calls or whatever.
Definitely.
Imagine if our voice is being captured on a day-to-day basis, and suddenly at some point, the voice changes. And this happens, when we call our relatives or friends and they say, hey, you're sounding very tired. Now imagine there's an AI or there is a bot which will tell, hey, there's a change in the pattern. Are you tired? Are you hypoglycemic in terms of diabetes? Are you forgetting things in terms of dementia, Alzheimer's? Are you repeating things unnecessarily, some kind of neurological disorders? There are a lot of coronary artery diseases. There are a wide range of diseases which can actually change the voice. And that's definitely at a higher level of AI. Those products are in the beta version in the Western countries. There are some Indian companies doing very preliminary work on that. But overall, in the coming days, of course, artificial intelligence with, I call it the VUI, the voice user interface, which will make it easy for healthcare to really move on in terms of a rather paradigm shift from being hospital-based to be more of a patient-centric healthcare delivery.
Very well said, Dr. Jaideep, especially the one you mentioned about was AI helping us in diagnosis. Well, definitely in combination with our brains as doctors, using voice AI with patients who can't tell us properly. Possibly we have a patient with Alzheimer's who definitely can't, maybe would not remember what is happening to him or her. They would not be in a position to tell us the symptoms. But yes, if we can have a AI like a voice AI leading us to a diagnosis or maybe even predicting the symptoms that the patient might be facing, it would make a world of difference. Definitely in the field of medicine, it would definitely be I would say a well-weighted or well-awaited invention or discovery if this happens. I would say I would definitely like to re-emphasize that people with Alzheimer's will definitely benefit a long way if we have a voice AI interpreting their symptoms. Thank you, Dr. Jaideep. Excellent discussion on this. So we have Mr. Abdullah Saleem next on the panel. Sir, what is the benefit of using voice AI or speech recognition in healthcare? How do you think it has affected the healthcare industry? You could talk about both pros and cons of it. Thank you.
Thanks for the questions. I'll just divide it, the voice technology into two parts. The healthcare industry perspective, the clinical and the non-clinical. And from the morning we are listening for the different speakers. They're talking about the CRM and the call center, the top line, bottom line, and ROI, how is going to help it. Definitely it's going to help, and it is being adopted, and this pandemic era has enforced the industry, especially the healthcare. Though the healthcare is the only industry who has adopted the technology very less compared to other industry like banking, mortgage, retail, automobiles, and the bottom, I'm talking about overall in the globe. At the bottom comes the healthcare. So now the healthcare has understand the technology is going to add value in terms of the better patient engagement, and this technology, voice technology for the administrative part, the non-clinical part, it's already started and the people are accepting it, though there are challenges in the administrative part also. I'll come on that. In the clinical perspective, the accuracy is very, very important. We are talking about the voice technology. If it is not 100%, then not a single doctor is going to take it ahead. For example, Dragon is one of the best tool which is there in the industry, which is say that 98%, 95%, even the doctors are not ready to accept it. If some, for example, if the doctor is recording a surgery note and it is just gone a bit of hair there, he just throw it and say, I don't trust on it, I'm not going to use that. So that is one challenge. Second challenge is that the government body, they have not proved it. The voice technology, they have not proved it, and still it is in discussion. And the committee like HIMSS India chapter is still talking to them, to the government body to give a consensus on it and make it a regular MOU so that we can adopt it. But of course, going down the line, this is the technology is going to fasten the clinical documentation, saving the clinicians' time, and it is going to help the clinical adoptions much better than what we are seeing here nowadays in the healthcare industry. Over to you.
Thank you, Mr. Abdullah Saleem. It was an excellent point you brought about adoption in clinical adoption in for voice AI. Well, yes, it can definitely help us in long way in documentation. If we're talking about completing our documentation in the hospital sector, voice AI can definitely play a huge role on this. We could keep our records up to date and things can be managed very well. Thank you for the insightful session on that. So we have Ms. Archna Gupta. Ma'am, since you are in the patient experience side, your question would be, what has the patient experience been while using the voice AI in healthcare? And what do you think would be the future of voice AI, especially in healthcare?
Thank you, Dr. Haleema. I would agree to him saying that healthcare has far behind in adopting technology. It's picking up. The pandemic has enforced a huge leap. It's picking up. But we are struggling when I was working with digitization also in healthcare in terms of, as you rightly divided, clinical and non-clinical. From a clinical voice AI, we are getting now options where it is quite accurate, what you call it, medicine language. There are some AIs which has understood the medicine language, which makes the doctor comfortable to use it. Earlier they were struggling and adoption was very poor. So now AI has developed. Similarly, from a non-clinical side, technical from a patient point of view, see, it's not simple if they call up a call center to book an appointment. It is not just like booking a movie ticket. They ask questions. They have several queries. And a person has to understand what symptomatic triaging they have to do. That is very critical.
True.
So AI needs to be, I mean, it can't be replicated from other industry to this industry so easily. Someone has to really have a deep learning on what are the symptoms and how do we guide the patients go to the right department and right doctor. So things are developing, are evolving, and for voice, yes, it has come. Some of the companies have come to that level also. And there are so many so many applications which will help the patients. I'll talk from the patient side.
Definitely,
It
yes.
is, simple things like the doctor gives me 10 medicines. Can someone remind me at every interval? Do we get SMSs? But SMS is also not effective. Maybe with voice, if I'm having some, a problem, I have some query when I come back post-discharge or post-OPD consultation, after having a medication for a day or two, it's very difficult to reach out to doctor again. Can I get my small queries resolved by someone who can guide me, okay, and then direct me to the doctor if in case a problem is there? There are so many applications. I mean, from the doctor perspective also, in the entire AI base, I mean, it can tell the track record as to, as you said, with the voice. I mean, it's really interesting. With the change in voice, they can detect there's something wrong, and the doctor can say, okay, come, just time for you to come to visit the clinic. Otherwise, they're able to help, remotely. Now is the time of remote consultation, telehealth. So how do we use the voice AI? How do we use from the clinician, angle? So much of applications. Thank you so much.
To add on this on a lighter note, when I would take my calls during the pandemic, I was actually volunteering and my personal number was out there in the social media. So I used to receive around 100 calls per day. So when I used to talk to my friends and colleagues, they would tell me, maybe a voice AI would have helped you better. The same questions, do you have fever, do you have cold, do you have cough? Maybe someone would have, kind of thought of voice AI, and I guess maybe I would have handled more patients than what I did. The end result would have been by me, the prescription, the interpretation would have been by our brain, the human brain and us. But the questions would have been very repetitive, and voice AI would definitely have helped me at that juncture. Well, yes, moving on, sir, Dr. Saurab, the questions for you again is the pandemic. So, sir, how has voice AI been beneficial to the healthcare industry, to the hospitals in particular, since you are in the you're the operation head of Max? So I guess we will stick on to the hospitals and the benefit of voice AI in hospitals during the pandemic. So, thank you.
So the pandemic sells well. That's the easy topic to do. But I mean, through the pandemic, we've seen a lot of ups and downs and a lot of stressful situations. Our doctors and our teams have been, in and out of the hospital. Many of them, losing loved ones themselves, getting positive. So it was a very different or a very unique kind of a pandemic this time, where we didn't really know what to do. And if I talk about pre-pandemic, it'll be unfair on technology. So I will take you 3 decades back. 3 decades back, hospitals basically used to be that small place where a big doctor can sit and see his patients. 2 decades back, there was a little bit of a transformation in the understanding of a hospital, where the doctor would find a space for himself where he could see his patients and have peripheral services like x-rays, ultrasounds, etc. done. A decade ago, hospitals suddenly became corporate. And neither the hospitals nor the doctors knew what to do. And eventually, that is when the scale-up phase, or rather the planning phase of hospitals actually started. So logistically, running a hospital is a very complicated battle. And when we say that we want to scale up, nobody even knew what AI or technology really means. The airlines industry went way ahead of us. The hotel industry went way ahead of us. But we were still following and trying to figure out our logistics in terms of hospital operations. Post the pandemic, suddenly what happened is that the doctors, the hospital teams, they suddenly realized that we can't be everywhere in every corner of the city or maybe the country, but we still need to treat. And it is that scalability or that efficiency which started driving technology and AI. So I would say that the progress we've made in the last 3 decades on technology is probably equal to the progress we've made in the last 2 years of the pandemic. So the one good thing that the pandemic has done to us is it has made us realize that without technology, it is not scalable. So small little examples that used to come to us before the pandemic were that, I can't type out, a doctor would come up and tell me that I can't type out a prescription because my patient doesn't feel I'm talking to him. Patient feels disconnected. Patient को बात ही समझ में नहीं आती है. They don't feel I'm attentive, and hence I cannot type a e-prescription. Today, the same doctors are coming back to us and saying, please give me something where I can, talk to the patient and at least use the e-prescription so that next time when the patient comes, I know what I had prescribed. I don't want handwritten prescriptions. Random experiments that we did were using magnetic pens, AI to the level of the fact that there's a magnetic sheet where the doctor writes an MRI to the patient and the radiology department gets an SMS that there is one patient in your premises who has been written an MRI, please catch him. So that level of innovation started coming in because at the end of the day, innovation comes only when there is a, necessity is the mother of invention. And that's where we suddenly started realizing that the doctors are actually asking for what we were trying to tell them for the last 5 years, 6 years. Doctors like senior endocrinologists of my hospital came to me and said, Doctor Sahab, हमारे patient को appointment देने की ज़रूरत क्या है? I need to see 4 things: HbA1c, blood sugar, CBC. Why should I see my patient? I go to my OPD, wear my mask, wear my PPE kit, see 10 patients, then come back, then go for a bath, then come back and, whatever. He said, why should I see my patients? And that is when people like me, and pardon my French, triggered an idea that if my patient doesn't come to the hospital, it saves me cost, it saves me logistics. There's so much of energy that gets saved, but the performance is actually the same. So we started working on models where we said that, let's keep the patient, sounds a little uncustomer friendly, but we said, let's keep the patient at bay. Let's say the patient ko bolo ghar pe baithe. We don't want the patient to come. Let's start doing things that we can do at home. So we started pharmacy deliveries because patients would come to say, take medicines. We said, no, please don't come to the hospital. We'll send it home. The patients were very happy. Then we realized, okay, let's do x-rays at home. So we said, don't come to the hospital for an x-ray. We'll do an x-ray for you at home. Then the doctor said, ki aapko aane ki zarurat hi nahi hai. I will talk to you on a video. So, all those things started falling in place, and hence, now after so many decades of healthcare, delivery in India, we have really started picking up speed on AI and technology. I must mention that, and I'm, as an ops head, I'm a firm believer that if there is a best practice happening in any other industry, we should shamelessly copy it. I don't believe in reinventing the wheel on things. So as we are talking, there is a pilot that we are doing in our hospitals where we are trying to replicate the web check-in process of an airlines to the admission of a hospital. So the patient gets a link, uploads his documents, tells us his preferences, and when I talk of preferences, it also means whether the patient is a vegetarian or a non-vegetarian, whether he has onion and garlic in his food or not. So that's the level of depth we are trying to go to make sure that when the patient comes to the hospital, everything is ready, it's predictable. When I talk of predictability, I want my teams to know that there are 10 patients coming in so that we can be prepared for them. We have actually geofenced our hospitals. Within 100 meters radius of a hospital, there is an intimation which comes to the front desk that, there's a patient who's coming in. And then this patient needs a wheelchair. So we want to integrate our processes so much that our team should know that this patient is 100 meters away from the hospital, needs to see an orthopedic surgeon. Last time when he came, he used a wheelchair. So please have a wheelchair waiting at the valet desk, or whatever, the porch of the hospital to receive the patient. And that is when we really will get into that mode of utilizing AI in terms of patient experience. So again, we've been talking of dividing patient, technology into clinical and non-clinical. I think there's a further division. The further division is whether we are trying to use the technology for the patient's experience or back-end logistics. And both are equally complicated. And both are absolutely vital to the business. So, this is obviously, we are talking about voice AI today, which is just a part of what we are looking at hospitals. But voice has come as, something where my doctors who are very, very busy doctors, who honestly step out of the OT for a minute to show the patient that, we are in the OT operating your patient. And half the time patients feel that somebody else is operating. So those doctors who are seeing 60, 70 patients a day, doing 40 surgeries a day, cannot be present everywhere. And voice AI is going to actually pull off
Definitely.
a lot of, unnecessary presence of those doctors and team members in, the patient space. I think the presentation before us has actually given some food for thought where we can actually replicate the doctors' voices and probably look at how we can utilize them to ask those basic 5 questions
Right.
that Dr. Haleema asks all her patients.
So, well, this would basically go hand in hand, as we already said, that yes, voice technology would definitely help, AI definitely helps in healthcare, but nothing to replace the connection of doctors and the patients and the in-person consultations and everything. But during the pandemic, AI has been very helpful, and people have taken very, I would say, taken advantage of the situation, and it has kind of scaled up now to a different level. And I would add on to say that technology helps in every field, and healthcare is not left behind. And we have to kind of accept it and move on, and maybe make it a part of the routine activity for us doctors also, as Dr. Saurab was rightly mentioning, that people and doctors who are really busy in the OT, operating 40 patients per day, can't come and talk to each and every patient. Maybe we can have voice AI assisted calls to them in the doctor's voice, talking to the patient's family, reassuring them the patient is fine, and updating them of the current situation of the patient. All this can definitely help during our acute and active practice now. And I would like to kind of sum it up saying that AI in healthcare is definitely at the juncture, and it can take over the primary and secondary care. Tertiary care still remains at the hospitals and still remains as in-person visits. But yes, primary and secondary care can be managed by AI in healthcare, and not to mention the voice AI in healthcare. So thank you, everyone. Thank you, panelists, for the excellent session and the great insight that you gave us. Open for the Q&A now. Thank you.
So in the healthcare, okay, so for every person, okay, health is a primary thing when compared to any other things. So, and the health depends on the food you eat, the liquid you take, and the air you inhale, and finally the premises how you be, okay. Now, using AI, can we do something on these parameters so that a person can be healthy for a longer time? So is there any innovation, any roadmap or any vision to work on this lane? Because if, for everybody, right, they want to have their own health. Okay,
Dr.
to be good.
Jaideep or Mr. Abdullah? So either of you, please.
Well, thank you. Thank you so much for your question. It's a great, timely question. And there are already apps which are existing in the Indian market as well. Definitely, like, I think we started talking about diabetes. And I was just thinking at lunchtime when I saw the malpua and the rabdi, right? So I wish I had an AI bot speaking to me, Baskar yaar, Baskar.
Don't have
And
it.
so it is possible, and it is coming up. Definitely there are, though we're still laughing about it, but in the next few years, not even 5 years, I will say in the next 2 or 3 years, these things will become normal. Like, I will have some kind of an assistant, like as a diabetic, to tell me how much rice I have already taken, and then how much I'm allowed to take from the malpua counter. So these are still in development. Some of them are already in beta version, like I said. Please explore, Google them up. We have great apps which are there. I'm not sure if many are represented here. But in the coming days, like how electricity is common, we are not in awe of electricity, or we are not in awe of internet. AI will also become like a, ye to hamesha se hai types. It's always been existing kind of a technology. And life will definitely change a lot. Like if the cell phone in your pocket has changed your life a lot, AI will be changing healthcare a lot. People will be not getting that sick with common diseases like even diabetes for that matter.
So I'll
You
just,
will have.
I'll just objectify that for you a little, if I understand the question rightly. So yesterday there was a patient who came up to one of our cardiac surgeons for a cardiac bypass, and the surgeon told him that अगर 6 महीने पहले आपकी एंजियोग्राफी हुई होती ना तो करनी नहीं पड़ती आज सर्जरी. So what I actually mean to say is that there are very objective flowcharts or processes that can be made, and there are thousands of diseases which can actually be put into an algorithm where a person can actually be prompted to do a preventive procedure with the wake of or with the intent of not landing up for a CABG if a angiography is done 6 months back, or maybe a lifestyle change is done 6 months back. So the answer that I want to give you is that there are all algorithms that can be made out of thousands of diseases, and most of that data is available with the hospitals, which can kind of move ahead and get built into a model or something that can be preventive in nature.
Okay. If you allow
Preventive
me,
healthcare, definitely it would help in the
if you allow me,
perspective.
I'll just add your the way you said that the health is very, very important, right? In the beginning, I said that healthcare is the lowest industry who has adopted technology, but the way the revolution has come during this pandemic era, down the line, it will be on the top, the way the globe is working towards the technology. Reason behind it is the demand of the patient, it is demand from the doctors, and it is the demand of the healthcare organization. And earlier, these three things were missing. That's why it was down at the bottom to adopt the technology. Adding to that, recently we have done that. One wearable device is there. It takes almost 20 vitals. In that, there is a ECG is also there. In that, there is a live heart rhythm is there. And based on the heart rhythm, it connected to the application for the hospital. And that is the chronic patient, it's the home care at home. He's not in the hospital, he's at home. But his condition, his heart is going deteriorated. The hospital and the team, the doctor who is treating, they're getting the notifications, and then start treating the patient, bring back the patient to the hospital and start the treatment. So there, we have done the pilot, but we are still waiting for the regulation body to say go ahead with the voice technology. And that is the only reason that even the voice-based biometric has not been implemented neither in any bank nor in any existing normal big manufacturing company or hospitals. Thanks.
Thank you, Mr. Abdullah. Any other questions? And just for the knowledge of everyone, today is National Telemedicine Day, and I think definitely the best day to discuss about AI and voice AI in healthcare. So I think really an honor to be here to talk about this subject now. So any other question?
If a person is going to a buffet, just by monitoring that particular person, can we suggest like you take or you don't take it strictly? So, I mean, because end of the day, what happens is food is the one which is impacting, it is contributing more towards your health. If an unhealthy person taking a food which he is not supposed to take, definitely he is going to impact his health. Okay.
True. So Dr.
Can I take
Saurab?
that? Okay. So just for your information, every large hospital has something called as a preventive health program. So the preventive health programs are designed in a way where they kind of do those relevant tests for anybody who, for example, if I talk about a cardiac patient and we go for a cardiac preventive management, there is a set of tests that will identify the risks, even the percentage risk, and suggest what changes need to be made. But unfortunately, this is all a manual process today. So if I go for a cardiac test today to a doctor and I am told that these 6 things need to be done, I continue doing them, but there is no follow-up and there is no digitization or algorithm to tell me that now it's enough, now you can get back to something like this, or maybe, you know, your cholesterol has suddenly increased, so we had told you to take fatty food, but you stopped taking fatty food and take more proteins. The, you know, the adjustment of those advices don't happen because it is manual in nature. When does this adjustment happen today is when I go for my next test. And that is what I as a patient decide. I should not be making that decision. I don't know how vital or you know, how much time I've lost. So those programs exist and they are very exhaustive. They are disease specific, they are specialty specific, they are age specific. There are some screenings for pregnant women which go from the date of pregnancy till the time of delivery. But why these tests are measured better than the other tests are because a pregnant woman goes to her gynecologist or obstetrician every month or every 15 days. So that gets tracked manually. But all the other situations are not tracked manually and hence the patient decides. So today I am in Bangalore from Delhi. If I were to get a test done in Delhi, I would skip it and say, I'll go next week. You know, and I don't know as a patient what these 7 days would do to me. So all of this process exists, the data exists, the utilization of that data and the, you know, algorithmization of that data is what is absent in healthcare today. So,
yeah, I think it is in the roadmap now. Such applications are coming up. I would suggest you to go through the Play Store and see. And there are multiple applications on diet restrictions, diet intake, and even there is reversal of diabetes on the way now. People are working on reversal of diabetes, and there are people who have benefited from it with an HbA1c from 8 to 5. This has happened. So there are applications, there's AI which is directing this particular field of reversal in diabetes also. So I think, yes, diet plays a huge role in that.
I think the opportunity area is basically the multiple variables that exist. There are so many variables, and for a tech startup or a tech company, that is the opportunity area to tap because there are so many variables. You control one, the other goes awry, but you don't get to know that it's going on. So I think that's the opportunity area.
I think with this, we would wrap up this session. What a beautifully articulated session. Ladies and gentlemen, can we hear it for Dr. Haleema Yezdani, Dr. Saurab Lall, Mr. Abdullah Saleem, Ms. Archna Gupta, and Dr. Jaideep, Jesson, Rayapudi. Thank you so much for being a part of this discussion. And we were honored and privileged to have you. Thank you so much.